All right, we're going to move on and get some expert advice here because major disruptions will keep going on with coronavirus. We don't know what's going to happen with church services. We're told about universities and transport being okay, but, you know, it's going to change life as we know it dramatically. There's a lot of old wives' tales spread on social media, and I have to say, I agree with Jane, a lack of information and clarity from the government. So I've got you an expert, Associate Professor Adam Kamradt-Scott. He's an expert in the spread and control of infectious diseases. He joins me now live from Canberra, and he'll help us demystify some of these issues. Thank you for your time, Professor. Let's start at the top. Give me the simple symptoms I should be looking for and how this differs perhaps from the flu we've all had or a cold we've all had in the past.
Okay, well, there's a lot of similarities in this respect because the initial onset of symptoms for the majority of people appear to be fairly consistent with influenza, which is going to present a bit of a challenge for Australia as we move into the flu season as well, because it won't be immediately clear whether or not people have contracted influenza or the new COVID-19 virus. Coronaviruses are known to circulate fairly widely every season with the flu season, and oftentimes when people say that they contract the flu, what they've actually ended up being exposed to is a coronavirus. This one is a novel coronavirus though, and so we haven't seen it circulate previously amongst the human population, and obviously there's a bit of a sting in the tail with this one. The majority of people though, and we've got this data fairly consistently now around the world, more than 80% of people only go on to develop mild symptoms. And in that, around 90% of people develop a high temperature or fever, 70% of people then develop a dry cough, and then around 1 in 5 people then develop a more serious illness, leading to around 6% of the population that develops a critical condition where they may require hospitalisation and intensive care.
So we're talking about body aches, a dry cough, not necessarily sneezing and those sorts of things, and certainly a temperature. That's another thing we're looking for, isn't it?
That's right. Those are some of the more common symptoms. At the upper end of the scenario, obviously you can end up developing a pneumonia, and that obviously is where we're seeing particularly the most vulnerable people in the population, our elderly, who are really succumbing to this disease, because obviously if you develop a high-grade pneumonia, you could then, it places additional strain on the heart. And so if you've got someone with pre-existing heart disease or some other serious clinical condition, it can just end up proving, it seems, too much for the human body.
Okay, and we all know that if people have any of these symptoms, they've got to dial ahead, they've got to get on the helpline, they've got to seek a remote, possibly Skype, possibly telephone call. We had a conversation last night with Dr. Mikesh Harkawell. He has a well-established protocol with his clinic in Melbourne for people to be assessed remotely. He then was doing swabs in the car park. We know we're going to have these fever centres shortly set up, announced by the government this week. So I think we've got that. But before we get to that stage, before we start feeling unwell, if we're ever going to get it, what can we do to prevent that? People talk about social distancing. What does that mean? Does it mean you don't go to the gym, that you can't swim in the swimming pool, but a game of tennis is okay? What do I do about restaurants? Do I measure how far one table is from another and say that restaurant's okay, but that one's a bit too tight and a bit too compact? What's the advice here?
Okay, so the most important piece of information that everyone needs to know is that you can reduce your risk of personal exposure through 3 simple measures, which is regular hand washing. Soap and water is fine. If you have access to a hand sanitizer, an alcohol-based rub, then obviously that's another option as well. Secondly, cough and sneeze etiquette. So either use a tissue and then discard it immediately, or cough into your elbow as opposed to your hand. This virus is spread through droplet form, so when people sort of cough and sneeze into their hand, if they then go and open a door handle, and someone comes along behind them, opens the door handle, and then rubs their eyes, then they potentially can be exposed. And the third thing is to avoid people who are visibly unwell. So you don't have to recoil in horror if someone coughs or sneezes in your proximity, but obviously you just need to reduce the level of exposure in that context. And we believe at the moment you need to be in close contact with someone who's coughing and sneezing, probably for around 15 minutes. So you're not going to just, if someone sneezes as you're walking past them, you're not necessarily going to be exposed in that context.
Okay, well, what about being on a flight? Go back to the gym example that I gave you and restaurants. What would you recommend? What would you do?
Yes. So with social distancing, we don't have evidence at the moment of widespread community transmission. And that's really important to keep in mind. At the moment, we've seen, obviously, the majority of cases have been imported into Australia. We've seen a number of instances of very close contact human-to-human transmission, and now there appears to be some evidence of limited community transmission. In the event that we start to see more widespread community transmission, then you'll see the government recommending more social distancing measures, such as obviously, we've heard today the cancellation of mass gatherings over 500 people, but also with transport, such as moving away from people or keeping a distance of around 1 to 2 metres in between individuals. And that needs to be applied sort of more broadly. So public transport through to any sort of communal areas as much as possible. Obviously, you need to be sensible about it. There's going to be circumstances where that's not going to be possible, but you need to, obviously, at that point, in the event that we end up with widespread community transmission, people will need to be more conscious about how close they're getting to other people.
Professor Scott, I mean, just give me the example of someone who's home. They're either in self-isolation because they fear they might have it, or they have a confirmed case and they're home and basically in quarantine. If they've got a spouse or someone that they're living with, if the children are at home, how do you manage that? Or do you just assume that the household has coronavirus?
Well, it obviously depends on the household and the extent to which that individual can potentially isolate themselves from the rest of the family. Most likely, though, you need to kind of treat the household as potentially having infected. So if you end up with one confirmed case, then obviously close contacts of that individual will also be encouraged to self-isolate for a period of 14 days. Obviously, we don't want people hiding in their homes and stop going out unless they are unwell or have exhibited symptoms. And so it's really important for people to remain calm. The virus does continue to only cause mild illness in the vast majority of people. But if you do develop symptoms, then obviously we're encouraging people now to reconsider their movement and avoid crowded areas and so forth.
Professor Adam Kamradt-Scott, thank you very much for your time tonight.
Thank you.